My name is Dr. Susan Graham. I'm the medical advisor for the Last Diet Ever. My role, and the role of the other physicians that work with Last Diet Ever, is to review thoroughly both the medical history that you provided for us and the lab work that you had done in order to ensure that there are no issues that might interfere with your progress and success in this program. I've developed a generic list of issues that can slow down the weight loss in any diet program. This list applies to any program that you would try in order to lose weight. It doesn't matter what that program is. Anything you do to try to lose weight, these are the issues that may interfere with the rate of your weight loss or your success with any program. So it's not just HCG, it's any way that you would try to lose weight. One of the most significant things is how much weight you have to lose. The more weight a person has to lose, the faster it's going to come off. So if you're a 6'4" male with 150 pounds to lose, you're going to lose it way faster than a 5'2" woman who only has, say, 25 or 30 pounds to lose. And as you're going through the program and you're losing more and more and more weight, then you also start to lose weight more slowly. In my mind, I picture it as though you're losing a percentage of your body fat. So the bigger the amount that you have to lose, that same percentage is going to be a smaller and smaller amount as you lose the weight. The closer you get to your goal, you'll also find the weight comes off more slowly. Age is a significant factor. It really doesn't seem to kick in until you're around your 60s, but really our metabolism starts to slow down when you're about 25 or 30. And it gets slower and slower over time, and then when you get to 60, it kind of like drops off. So the older you are, the slower you're going to lose weight. Your whole metabolic systems and everything slow down. But I think that's actually an advantage, because as you get older, your body adapts more slowly to change anyway. So if you stand up quickly, you're more likely to feel that your blood pressure doesn't stay up with you. So when you're losing weight really rapidly, there's a lot of physiological changes that go along with that. And the older you are, the harder it is for your body to adapt to those changes. So I think it's actually a good thing. So if you're 25 or 30, you might lose a pound a day. If you're 60 or 70, it might be a half a pound a day. But it still should be a nice steady rate of weight loss. Candida is an organism, it's a yeast that can actually get into your system and colonize the intestinal system, especially if you've been on antibiotics. One of the problems with it is that it's a sugar-loving organism, and it will actually make you love sugar. It'll drive you to get sugar in order to feed itself. As you're on a program like this where you're not eating the sugars and you're not eating the carbohydrates, the yeast will go into a dormant state and have less effect on you. But if you cheat, if you eat a cookie one day or some crackers or you have some white flour of any kind, then it's going to awaken that yeast. It's like sprinkling a little fertilizer on the yeast, and it's going to start to grow again, and it's going to start causing some sugar cravings. So it's one of the reasons why it's so important not to stray from the list of foods that you're allowed to have on this program. Constipation, aside from the fact that it's just an uncomfortable feeling and it's very toxic because that's waste that's being held in your body that should be being released, it makes you bloated, and it makes you feel fat. You can get water retention associated with that, which also can mask your weight loss. So you might actually be losing some pounds, but it might not show up on the scale because you're replacing it with water. I also kind of theorize there is a reflex that's built in, that when you put food into your stomach, it triggers the other end to empty. They call it the gastrocolic reflex, and it's the normal thing. You get up in the morning, you have your coffee, some breakfast, and then you feel the urge to move your bowels, and that's the normal reflex. I think it kind of works in reverse, that if your bowels are full, they may trigger you to be hungry in order to elicit that gastrocolic reflex to help the bowels empty. I don't know that that's really true in a book, but that's what I think. Depression and anxiety are on the list because depression can be the result of a serotonin deficiency. Serotonin is a brain chemical. It's called a neurotransmitter, and it's how one brain cell talks to another brain cell. If you don't have enough of that, one of the symptoms that you may experience is depression. But serotonin is not just for mood, it's also appetite and energy and sleep. So if your serotonin levels are low, then you may have issues with those other problems, all of which can trigger some weight gain. Diabetes or metabolic syndrome also trigger weight gain, and they make it harder to lose weight when you're on any kind of a program. There's two types of diabetes. There's the insulin dependent and the non-insulin dependent. Basically, insulin is a fat storage hormone. The calories that you take in are transformed into fat if they're not used up in your body. So the higher your insulin levels are, whether it's from the disease itself or whether it's from the medications you're taking, then that will cause you to gain weight, and that weight tends to be around the belly. And of course, abdominal fat is the most dangerous and it's the hardest to lose. Metabolic syndrome is an inherited condition where there's a tendency towards high blood pressure, high cholesterol, high sugar, and you also see that abdominal weight gain, which is, again, very hard to lose. In all honesty, I don't know any program that's better than this, though, for getting that abdominal weight off. Emotional or stress eating, HCG does not change who you are. It doesn't change your emotional needs. And if you have learned to eat as a way of satisfying your emotional needs, the HCG is not going to change that. However, I think that the fact that you're losing weight so quickly and so easily and you're seeing results immediately is such an encouraging thing that it really can lift your mood. And I see a lot of women who have been suffering from what's been thought to be depression. Actually, they get better. They start losing weight and they find a new self and they feel better about themselves. Some of the other things that are helpful for that too are acupuncture. There are some other compounded medications that are also available that we also have made by Buderer Drug Company. So those are also options that I can discuss individually with any one of you. Fast metabolizer of medications. Most people think a fast metabolizer means you'd be skinny. This refers just to how well you metabolize medications. The liver processes the medications that you take in. Some people take very small doses, they get a lot of side effects, but drugs work really well for them. They're slow metabolizers or normal. Their bodies get rid of the drug as fast as it's supposed to. Some people are really fast metabolizers though. So they might need to take 3 aspirins for a headache or 3 Tylenol or 800 milligrams of Advil when smaller doses would work for other people. The more that you see that type of thing, the more likely it is that you would need a higher dose of the HCG. So if you find that you're maybe losing weight but you're staying hungry, you may need to have a higher dose. Or you might not be losing weight and you might be hungry. That also may be a situation where you need a higher dose. Gender is a big issue. Men lose weight so much more rapidly than women, as most of you women already probably know. Men have a different body composition, they've got more muscle on their bodies, and they have a different fat composition in their bodies. Women have an extra layer of fat right underneath the skin, and it's what gives us the soft look. It's why women can't get really strong muscle definition even when they're lifting weights. They might be able to lift as much weight as a man, but still not have that muscle definition, unless they're taking some illegal hormones. Women tend to lose weight kind of like this. They'll drop a little bit and they'll go back up, they'll drop some more, they'll go back up, and most of that is water weight, and it's based on the hormone cycling. Even if you're in menopause, that can happen. Men tend to lose weight like this, just every day it comes off a little bit more. So the best thing for women to do is to focus on how much weight is lost in a whole week, and then divide it, because if you get hung up on, oh my gosh, I'm down a half a pound today, but then the next day you're up a pound, and then you're down 3 pounds, it can be discouraging. So look at your weight in the respect of a week-long amount. Hormones can be a really, really big issue, and most women will know that they started their periods, they had a pregnancy, they go through menopause, any big hormone shifts, and they'll start to gain weight. And there's all kinds of different interplays between the different hormones. And it's the thyroid gland, the adrenal gland, the female and male sex hormones. All of them come together to control things like insulin and blood sugars and weight gain. So if you have gained weight after a pregnancy or during menopause or because you went on birth control pills, then hormone imbalance may be one of the factors in why you've gained the weight. There is testing that can be done, which will be offered through here, not actually part of the Last Diet Ever, but something that we can arrange for you to get the testing for those hormone imbalances. And then Matt Buderer's drugstore would compound the replacement hormones that you would need to bring you back into balance. Medications are also significant. Individual medications themselves can actually cause weight gain. So a lot of the antidepressants or steroids will actually cause you to gain weight. Some just cause you to stall. You just find it very tough to lose weight, like diuretics. Even the number of medications, you might be on 5 medications, none of which cause weight gain, but actually you'll gain weight because you're on 5 medications. A lot of times, so you can come off some of the medications, especially things like blood pressure pills, some sugar pills, diabetes pills, sometimes heart medications. There's different things that some individuals are able to come off of. A significant thing is high blood pressure medications. The blood pressure corrects itself very rapidly with this program. Even before you've lost a significant amount of weight, you may see that your blood pressure is already coming down. So if you find that you stand up and you get kind of lightheaded and you see little white dots, that could be low blood pressure. So you need to stay in close contact with your family doctor. Check your blood pressure every day. and let them know what it is. And if you start getting those symptoms, talk to your family doctor about perhaps having a lower dose or even coming off some of those medications. The same would apply to blood sugar medications as well. Pain is a major stressor on the body, and as a stressor, it causes a lot of other hormone adaptations. If it's chronic pain, significant pain, like something like fibromyalgia, peripheral neuropathy, severe arthritis in the spine, causes a lot of stress, and in turn, the stress causes you to make more cortisol. Cortisol is the long-term stress hormone, as opposed to adrenaline, which is the short-term stress hormone. Cortisol causes your insulin levels to go up, and insulin, being the fat storage hormone, causes you to retain more of what you eat and store it as fat on the body. Pain management is extremely important. Treatments can include not only medications, but also chiropractic, acupuncture, physical therapy, massage, Reiki. There's all kinds of alternative treatments for pain that may be as effective or potentially even more effective than what you're taking for pain medications. Sleep is also a huge factor. In fact, I think sleep is probably one of the biggest things, especially for women with small children or people that are on shift work. If you don't get enough sleep, or if the quality of your sleep is poor, that again triggers those adaptive stress mechanisms like the higher cortisol. There's also a hormone called ghrelin that is released when your brain is tired. The brain functions primarily with sugar as its fuel. If you don't have enough sugar in your body, enough fuel for the brain, it'll be tired and it will demand that you go get some sugar. And it does that by way of releasing this ghrelin. Because it's a survival mechanism, it's almost impossible to resist that. And it will make you go get some sugar in order to feed your brain. So if you didn't get a good night's sleep, if you're doing shift work, if it's late in the evening and you're just craving something sugary, the best thing to do is drink a big glass of water and go have a nap or go to bed if it's nighttime. The water, because dehydration is often mistaken by people as hunger. You don't actually feel thirsty until you're about 15 to 20% dehydrated. So the earlier phases of dehydration can feel more like hunger. Sleep can be improved with medications, but of course then there's the potential for side effects. Some of the natural things you can use are melatonin and 5-HTP. Melatonin is what your brain makes itself in order to put you to sleep. And when you think of people when they lived in caves and they didn't have electricity, as the sun was going down and the light coming into your eyes was becoming less and less, the brain would produce melatonin, and the melatonin would put you to sleep. It only lasts for a short time in your system because all it's for is to initiate sleep. So if you have trouble falling asleep, melatonin is a good alternative. Just make sure that you buy a good, reputable brand. There's not a lot of regulation in the nutrition industry, as you're probably aware, so it's hard to know what you're getting over the counter. So be sure that you buy something good. 5-HTP or tryptophan can also be used by some people to help them sleep. It's the precursor for serotonin. So as I mentioned earlier, serotonin is the chemical in the brain that helps with sleep. So if you're not sleeping well, if you're waking up through the night, then tryptophan is a good alternative. But if you're on an antidepressant, check with your doctor. Many people who are on antidepressants cannot use the tryptophan. Other natural methods to help with sleep include things like acupuncture, exercise, weight loss, avoiding alcohol, caffeine, and other stimulants, and also some counseling to maybe help with the stress or the anxiety. Stress just in and of itself is the same as the sleep issues and pain issues. It causes increase in cortisol and therefore triggers weight gain. Smoking is not so much a risk factor for weight loss or not losing weight. The problem is that there's over 4,000 chemicals in cigarette smoke, and a lot of those chemicals get stored in your fat cells. You're emptying out your fat cells so rapidly with the HCG that you're releasing those chemicals back out into your body. When those chemicals are dormant, they're in a storage phase inside the fat cells, they contribute to things like cancer and heart disease and lung disease and so on. But when they start coming out of storage and into the bloodstream, they can just make you feel really lousy. There is a detoxification effect that happens anytime you lose weight, because as the fat cells empty, they release things that are stored in there. And it could be chemicals from gardening or from working in a printing company or the exhaust fumes from cars if you live in a big city. So those chemicals are being released into the bloodstream, and they can cause things like nausea, headaches, fatigue, muscle pain, your skin can even hurt. The only thing you can really do is try to flush those things out of your system with lots of water, lots of green tea, and it takes about a week or two to get that stuff out of your system. If you have time to do a detox program before you start the last diet ever, that's not a bad thing to do at all. You can also take either Tylenol or aspirin or the generic versions of those for any of those symptoms as well. They're quite acceptable on this program. You know, you're all doing something absolutely wonderful for yourself by engaging in this program. It might be a time to think about quitting smoking as well. My concern is that, you know, right now you're storing this much chemical from the cigarettes in this much body fat. But after this program, when you've only got this much body fat, if you're continuing to smoke, you're now going to be taking that many chemicals and storing them in a much smaller space. My concern is that maybe they're going to have a greater impact on your health at that point. So while you're doing something so fabulous already, maybe think about quitting smoking now as well. People that have a low-acting thyroid or hypothyroidism, even if they're on the correct medications and their blood tests are all normal, they still may have slower metabolisms than normal and therefore lose weight more slowly. But that's just a possibility. Most of the people that are hypothyroid, when they do this program, they still lose the weight loss that, like everybody else does. Now, surgery is an interesting thing. We think that surgery is safe because you're in an OR and you've got doctors with gloves and masks and you're asleep. Seems pretty safe. But I think that the body recognizes that as having been an attack. Like basically, my God, somebody tried to kill me while I was asleep, came at me with a knife, took my gallbladder out. If that happened to you on the street, you'd be thinking you were lucky to be alive. But when it happens in the OR, we sort of think like, oh well, that's okay. Well, I think that our bodies at the very animal level that they are, responds to that. And one of the ways that it can protect itself is by putting more weight on. So if you can imagine that when we were living in caves, the biggest enemy was the saber-toothed tiger. If you only had this much fat on your belly and the tiger gets you with its claw, it can go right through that layer of fat, grab something from the inside and pull it out. You're probably going to die from that. If you do survive though, an obvious adaptation mechanism would be to increase the amount of fat so that if the saber-toothed tiger gets you again, it's just going to get a paw full of fat and it's not going to get something inside. Plus, if you've got some extra calories on the body, you've also stored up some extra energy to survive if you get attacked again. What I've seen in my own practice is that the more surgeries people have, the more weight they tend to gain, especially if those surgeries involve the abdomen or the chest. Yo-yo dieting is basically going on a diet and losing weight and then gaining it back and going on another diet and losing the weight again. Anytime that you eat less than 1,200 calories a day, you will go into starvation mode. You trigger certain adaptation mechanisms. And one of those is that your basal metabolic rate, or the speed at which you burn up calories when you're resting, slows down in order to conserve that fat. The body tries to keep that fat on for as long as it possibly can, because it doesn't know when there's going to be food again. By the time you see this video, you will have met with your personal Last Diet Ever counselor who will have reviewed the entire program with you. Your counselor has been extensively and thoroughly trained in all aspects of the use of HCG with weight loss. If you have any questions at all about any aspect of the program, please talk to your counselor about that. It's very important to us that all of your questions have been answered and that you feel absolutely perfectly comfortable proceeding with the program. In addition, you'll be meeting either with me or with one of the other physicians for Last Diet Ever who will answer any personal questions you may have and also review your lab work. Congratulations on doing something really wonderful for yourselves. And you know, if you follow this program exactly as you've been taught, this very well may be your last diet ever.